Nancy.
Thank you, Chris. Today's topic is Medicare. And I know when Chris and I have talked in the past, she's like, are you serious? It is not simple, Nancy. But my goal today, and should you decide to meet with us in the future, is to help you understand all the parts and pieces of Medicare, because it is anything but simple. But I have 17 years of experience in helping people with their Medicare, whether it be on the front end in terms of the enrollment process or their selection of supplemental plans. And over the course of time, I have put things in a very logical process for you to follow. So hopefully that's exactly what's going to happen here today. Just so you know, the name of our firm is Cornerstone Retirement Partners. We were formerly known as Ron Courser and Associates. So anybody that's participated in the past or has viewed any type of video, it was under the old name of Ron Courser and Associates. So Ron is my husband. He actually started the firm. We started as Cornerstone Retirement Partners, and then we changed the name to Ron Courser and Associates, and now we're back having done full circle with the name Cornerstone Retirement Partners. In terms of my team is the health insurance side of the business versus the wealth side or the retirement planning side. And just to let you know, I am not a one-person show anymore. I was for many years, but the practice has grown, and I also have two other folks. One that does the very same thing that I do. Her name is Kristen. And the other person is Lauren, and she's more or less the back office person and support person. So without further ado, this is an educational seminar, and what that means is that I can't move this thing. Okay, just a minute here. There we go. The event itself is educational, meaning that we're not going to be talking about any plan-specific benefits. Know that my background is that of an independent agent, which means I do have access to all the different insurance companies that are out there. And for some people, that is an advantage because we might look at one company based on a person's health and find that another company might be better suited for that person. So by being an independent, it definitely gives us more flexibility in terms of helping you. A little bit more about the background. Again, I told you 17 years. Prior to that, I worked in the office furniture business. I started with Hayworth, and then I also worked for Herman Miller. I had an opportunity to come work with my husband, Ron. He had launched the company 17 years ago and said, what do you think about coming aboard and helping me? Little did I realize that my specialty would actually be Medicare, but more and more people, his clients, said, Ron, I'm overwhelmed. I'm getting all this information in the mail. I do not know what to do with this thing called Medicare. And it became kind of a natural niche in terms of me being able to help not only his clients, but also be able to help other people. I am very much a relationship-oriented person. And what I mean by that is during the open enrollment season, which we'll talk a little bit more about, I do promise an annual review. So I am not a one and done type of agent where I sign you up and then you never hear from me again. I always make sure that you have the opportunity to come in during October, November, and part of December if you want to talk about your plan, because that's when you can make any and all types of changes. We also stay in touch with you throughout the year to the degree that you would like. And we also have recently introduced a newsletter that people have found very helpful. So again, at Cornerstone Retirement Partners, we're located on the southeast side of Grand Rapids. We do say we connect the health and the wealth because they really do go hand in hand. So it might be one of you feels like these pictures. I'm overwhelmed. I don't know where to start. I'm getting bombarded with all this information. I hear all these ads on TV, which have been abundant over the last couple of years. And it's a topic that until you get close to looking at it, when you turn 65 in most cases, you really don't give it a lot of consideration. But then within within a year or so of turning 65, all of a sudden people are coming at you. You're getting phone calls as well. Know a couple of things. One, you are not allowed to be solicited by way of a phone call. So unless you've initiated the call, it is against the rules. The other thing is some people will wonder how we get paid as an agent, and we are compensated by the insurance company. So as Chris had said, we do offer a complete analysis at no cost anytime you need it, whether it's when you're first coming aboard or during open enrollment. But our goal is to take every one of these scenarios here in front of us and put a real smile on your face where you're going to walk away and say, that made some sense. I'm glad I came to see you. I've done some research on my own, but now the pieces of the puzzle, because it's very much a puzzle, are starting to come into view. The name of my program is Medicare Made Simple, as I said earlier. So today we're going to do a little introduction to Medicare. We're going to talk about how you go about getting enrolled, because there's two different ways, depending upon whether or not you're collecting Social Security or not. The parts of Medicare, which do have letters A, B, C, and D. We're going to talk about costs and coverage. We're going to talk about your supplemental options. And I will say this is where it gets a little tricky because everybody uses different words for the same vocabulary. So I'm going to make it real clear when we differentiate between the Medigap versus the Advantage plan. We also have prescription drug coverage that is now available to everybody. And as Chris said at the end, if we could hold our questions, then we'll make sure that they all get answered. Now, the material that was actually sent to you recently, just so that you know, the first 4 pages are basically an outline. So it's something that you could fall back on with a little bit more detail. The one document right after that is referred to as the Medicare cost structure. So when I start talking about what Medicare costs and what the coverage looks like, and I rattle a few numbers, you're going to be able to go back to that worksheet and refer back to what I'm talking about. The next sheet that you're going to have is what's called Medicare Choices, and we're going to clearly differentiate, like I say, between the supplemental options. There's also a sheet in there for those of you that may be a candidate for what's called the donut hole. It's got to do with prescription drug coverage. It's fairly detailed, and again, I'm not going to go into a lot of detail today, but believe me, if you have any questions whatsoever about that, I'll be more than happy to help you in reference to that. But you'll get a little bit of a snapshot of it today. There's also another worksheet in terms of how does Medicare work with other coverage. So part of the reason for the poll was to get a better understanding of where everybody is, because we're all unique. We've got different ages. We live in different parts of the country. We have different zip codes, we have different health history, so on and so forth. But what's most important with this presentation is for anybody who is getting ready to turn 65, there are some things that you definitely need to take into consideration. And hopefully those of you that indicated you're already on Medicare, you have already taken them into consideration. So it's very much a process. But we highly recommend that 6 months to 12 months in advance of turning 65, you start to get educated. So that's exactly what we're going to do this afternoon. So about Medicare, it is a national health insurance program. I believe it's here to stay. It was introduced in 1965 by the President LBJ. It was part of the Great Society. Along with that was the concept of people retiring at 65 and taking their Social Security benefit, along with the opportunity to take health insurance, because not a lot of companies had retiree insurance. So the government said, you know what, we're going to have you pay into the system, the payroll system, and you're going to become eligible for Medicare. It is administered by the Centers for Medicare and Medicaid. Today's topic is strictly Medicare, those people that are eligible because they're turning 65. There are some folks that are eligible for Medicare because of a disability, but this is not to be confused with Medicaid. Medicaid is a totally different animal altogether. So the people that are eligible are going to be anybody that's over the age of 65. They are a U.S. citizen. They have been a legal resident who has continuously resided in the United States for the last 5 years. Again, there are some people under the age of 65 that because of a disability will qualify for Medicare. And that typically is 25 months after the approval of their disability. So sometimes they're a little surprised and they get a card in the mail and they're like, oh, what is this? Well, it's because they automatically became qualified. Now, whether they decide to take Medicare Part A and Part B remains to be seen. And we're going to talk a little bit about that. Because even if you get your card and all of a sudden here it is, you may decide that's not the right step for you because you might be working or you might have a spouse who has a health insurance plan that you are currently on. Also, people of any age with end-stage renal disease are entitled to Medicare. Let me mention one other thing in terms of this, and that is the eligibility for Medicare is also tied to having worked at least 10 years or more. So if you look at your Social Security record, it will tell you how many quarters you have worked. You must have worked 40 quarters to qualify for your Medicare Part A and B, as well as your Social Security. So interestingly enough, a couple of weeks ago, and I've not had this before, I had 2 women who had 39 credits. So they did not qualify because of their own work record, but because they were married, they are going to qualify because of their husband's work record. So that's just a little bit of an aside there. Medicare is full of tons of exceptions and lots of nuances. And again, very customized in terms of I'm working or I'm not working or I'm disabled and so on and so forth. Again, those are all things that today we're going to help simplify a little bit and provide some clarification for. So you'll often hear about Medicare enrollment periods, especially when you first come aboard and then again in the fall. So when you first come aboard and you only get one of these, whether or not you take it remains to be seen. But if you're turning 65, and let's say that you were on an individual plan and you want to take your Medicare, you're eligible for it, you are going to get what's called an IEP. It stands for Initial Enrollment Period. And again, the government is full of acronyms. So here's a couple right now that will often stand out. So in the event you did not take it when you turn 65, it might be because you are working. When you're working and there are more than 20 employees, you have an option. But when you decide you're going to retire and now you need your Medicare, you will be granted an enrollment period referred to as an SEP. The SEP stands for a special enrollment period. So you had to pass on the IEP because you were still working. Now you're entitled to an SEP. An SEP is for the person who is retiring and doesn't have access to any other kind of health insurance, either by way of a spouse or a retiree plan. Now they're on their own and they want fully the benefits of Medicare. So with an SEP, there are 2 forms that are required to be filled out. One of them goes to your employer and the employer fills it out because you're no longer 65 now. Let's say you're 70, you've decided to call it quits. Your employer will fill out the form on your behalf. You also have a portion of the form. They'll return it. And it says to the government, do not penalize this person. They were working and they were working for an employer that has 20 or more employees. So that's the key to that. The other document is it's highly recommended that when you do turn 65, that you do enroll in Part A. The only exception to enrolling in Part A is if you are on a high deductible health savings account. And again, we'll come back to that. But most people, when they come aboard with an SEP, they have the 2 forms, they get it filled out. You want to plan at least 45 to 60 days in advance because these forms need to be processed by Social Security. So Social Security is responsible for helping with the enrollment of Medicare, and they're going to collect the Part B premium of Medicare, which we'll be talking about. It is Medicare, because we've got Social Security and Medicare, two very distinctly different groups. Medicare gets involved with the claims determination and whether or not something is Medicare eligible. So the SEP, you're working with the Social Security office here in Grand Rapids. They have some more electronic tools. We'll talk a little bit about that. They're making the process a bit simpler, but it's still a little paperwork encumbered. The next one is entitled AEP. This is a huge time of the year for myself and my staff. It's called the annual election period. This is when a person who's already on Part A and Part B says, I might want to make a change. I at least want my agent to help me review the plan that I have. What I will say is when you're on Medicare, you will receive from your supplemental companies in October, by October 1st, what is called some benefit information. So they are required to respond prior to the new year with all the plan changes that will be planned for the upcoming year. So we highly recommend that you take a look at those, but a lot of people will have questions and they'll give us a call. Anything that is changed between October 15 and December 7th, that's the window, it's about 10 or 11 weeks long, is always effective on January 1st. The other two enrollment periods, we're not going to spend a lot of time on them. The first one is called the general election period. This, unfortunately, is for the person who missed out on either the IEP or the SEP. They just decided to do nothing altogether. Unfortunately, they're going to have a penalty. It's lifelong. They can only enroll in Part A and Part B in the first quarter of the year, and then it starts in July. So there's a lot of downside to not understanding the enrollment periods. The other one is entitled the OEP. This has been around for the last 2 years now, and it's really a do-over, and it's not widely publicized. But if anybody is listening and they have a Medicare Advantage plan, and they said, you know, I really made a mistake, and here it is February of the next year, they can actually make one more change, and it's called the Medicare Advantage Plan Open Enrollment. Again, it's not widely publicized, but when it does come up in conversation, I will present that to someone. And once in a great while, somebody will say, you know what, I do want to take advantage of that do-over, and it's only for a Medicare Advantage plan. So we're out of that period of time, given the fact that we're in May, but that does still exist, and I would anticipate that being around for a while. Okay, so let's talk a little bit more about the Medicare enrollment. What we've got is people that are on Social Security and people that are not on Social Security as they are approaching the age of 65. When you turn on Social Security, the earliest age in doing that is 62. So you could have somebody who turned it on at age 62, 63, they're collecting, so on and so forth. And all of a sudden, surprise, surprise, they get their card in the mail. So they will receive their Medicare red, white, and blue card. It is paper, and it will occur about 3 to 4 months in advance of your birth date. Also keep in mind, if your birth date, well, they always will go with the first of the month. So let me say it this way. If your birth date was May 23rd and you were eligible for Medicare, they would make your card effective May 1st. Now, if your birth date was May 1st, they would make your card effective April 1st. So in that situation, they would backdate it. But it does come in either a brown or a white envelope. It looks a lot like junk mail, so you got to make sure you don't throw it away. And this is going to be your card. Now, if for some reason you lose it or it gets washed in the washing machine, you can request a replacement card at no cost to you. So the point here is it is automatic. You will also receive a letter from Social Security indicating that you will be seeing an adjustment in your retirement benefit. So we're going to talk about what that looks like for this year. The base premium is $170.10 a month. So the person collecting Social Security will have it automatically deducted from their retirement benefit, and they will be notified of that. Again, for anybody that is working or they have access to that spouse's plan, probably more so the spouse's plan, if they had turned on their Social Security, they got the card in the mail, but they thought, wait a minute, I'm part of my spouse's health insurance plan. They will be able to decline Part B and return the card or call Social Security and say, I don't need Part B, nor do I need to pay for it. I do have access to my spouse's health insurance because there are 20 or more employees on the plan. The only exception to any of this to keep in mind is that when you have any part of Medicare, whether it's A only or B, A and B, okay, because it would be A or A and B, you cannot participate whatsoever with an HSA. So what sometimes happens is somebody signs up for Social Security, they get their Medicare card, they don't want Part B, they're on a spouse's health insurance plan. The government will not take Part A back. No matter what you say, no matter what forms you fill out, they figure because Part A has no premium, it's zero, they're not going to take it back. So it automatically negates an HSA contribution for that person going forward. So this can be very important, especially because HSAs are becoming more popular. It's a wonderful way to save for some of those healthcare expenses. So you just need to know how this part of it works in relationship to being on Social Security and getting your card. This is the other option. So many people are not collecting their Social Security. They're going to wait until age 70. That's the maximum age. So in the event that happens and they're evaluating their Medicare and deciding that they do want it, okay, again, this probably is a person that's coming off of the marketplace, okay? They cannot stay on the marketplace plans when you turn 65. They will have to enroll online in their benefits. So here's how this works. So for starters, you have to take action before you turn 65. There's actually a window, we're going to see it on the next page, for the initial enrollment period. They give you 7 months to do something online. The doing something online has to do with getting into your Social Security account. So if you haven't set up an account, I highly recommend that you do that because more and more they, being Social Security, are encouraging you to do things online. If you absolutely don't want to do that, they will allow you to make an appointment. Generally, the appointments are probably, right now, they're probably running 5 to 6 weeks out in terms of going into the Grand Rapids office for those of you that live in Kent County. Otherwise, you can call the toll-free number and they will assist you over the phone, or you can walk into the Social Security office for your local area and wait in line. They are now open again. They've been open for about 2 to 3 weeks. I've had a few clients say, I've gone in, I had to wait an hour, but I accomplished what I needed to accomplish. So again, for those folks that say, I don't want to get online, I don't want to have to figure this all out, that's how that works. Keep in mind, if you want help with this, we will help you, even if it means setting up a Social Security account. The only thing is you have to have a smartphone because the way of verifying who you are, they'll send you some codes and we have to have your phone and so on and so forth. But again, if you want some help, we're more than happy to work through this with you. So let's go on to the next page. So the person that is not collecting Social Security, they must decide if they want Part A and B. If they want Part A and B, they will be looking at the ability to get online or make an appointment, and they have to do it 3 months before their 65th birthday. They cannot do it 4 months or 5 months. The window there is a 90-day window with which to say, I want my Medicare Part A or my Part A and B. So they will then either pick the first, second, or the third month. It takes about a month for you to get your card. And if you do anything online, they will notify you with a letter that you have been approved, and they'll give you some of the key information that's needed in terms of going to your next step. Once in a while, somebody will use the 3 months after your birthday to go ahead and actually enroll. But know that you'll always get your birth month when you turn 65. So again, if it was May 23rd, they're always going to give you 5/1 for your Part A or 5/1 for your Part A and your Part B. Now, when it comes to paying for your Medicare, because Medicare is not free, there is what is referred to as the Part B. We're going to talk about that. A person who is not collecting Social Security will get a quarterly bill, and that bill can be paid either with a credit card. It could be set up with a different checking account, or you can just go ahead and pay it quarter by quarter by quarter. That applies to somebody who is what we refer to as a first tier beneficiary, and we'll speak to that in a moment. But here's the card. So on the left-hand side of the diagram is the old card. So for those of you who perhaps helped your family members, grandpa, grandma, and so on, this is what their card would have looked like. So about 3 or 4 years ago, the government said, we've got to get that Social Security number off the card, because that used to be the Medicare claim number. The -A was indicative of whether somebody was collecting Social Security or not. We still had the effective dates, and they still reside on the new card, and there was even a signature. So now when we move over to the right-hand side, the card is still the same size. It's still paper. We have a person's name. We have a Medicare number. Well, now it is a randomly assigned number that becomes yours for the rest of your life. So it's an 11-digit alphanumeric number that is uniquely your number. This is the number that is needed to enroll in supplemental plans. Every card will either represent a Part A and B. So in this example, this person decided they were going to take their full original Medicare, that was A and B. Some people have only Part A on their card. And those, again, were people that said, I have access to a group plan. There's 20 or more employees. I'm not on an HSA. There's no downside to this. The beauty of being signed up for Part A, given those conditions, is it's a lot easier when it's time to call it quits and you want your Part B if you already have your Part A, because you already have your Medicare ID number and they're not going to change it. So when it comes to filling out the paperwork, you're already a step ahead in having your Medicare number. Now, just so you know, for those of you that are on an HSA and you want to continue to participate, no problem. We can definitely give you your Part A and get you your Part B. It's a little trickier, but it can all be accomplished. The only thing you have to remember there is, let's again say you were working and you were now 70. You wanted to contribute to an HSA. You did not turn on your Social Security, but now you're going to turn on your Social Security. You're going to turn on your Medicare. The person that was on the HSA turning 670 needs to try to remember to turn off their contributions to the HSA high deductible plan 6 months prior to when they want it to start. So the point is, the government will backdate your Part A. And if you don't turn off the HSA 6 months prior, you're going to have contributed to an HSA, and the government is going to penalize you for months that you were not allowed to be in it. And again, remember, this only applies to after age 65. So it's the person who's still working, who's 67, 68, and contributing to an HSA. Sometimes they don't know when they're going to retire, or perhaps there was a downsizing within the company. Not much you can do about that from that standpoint, but the government will always backdate your Part A 6 months from the date you want it activated. And then you're going to be able to request the Part B date when you want it to start. So I've kind of briefly mentioned this, but general rule of thumb is if you are covered by an employer group plan or your spouse's, okay, and that plan has less than 20 employees or more, you must sign up for Part A and Part B. So unless you are covered by an employer group plan that covers 20 or more, you must enroll at age 65. So sometimes that catches people off guard. But it's very clear that the government rules are the 20 employees or less must sign up for Part A and Part B. The other thing I would tell you is that then I had a pastor from the church that I go to. He said, you know, Nance, I didn't sign up and I'm on the group plan and I'm now 67 years old. Should I have done a comparison between taking the group plan and continuing to work beyond age 65 versus moving to an individual Medicare plan and supplement? So what I'm going to do for him, and I would recommend that you consider this as well, is sometimes you find that the group plan is more expensive in terms of the premiums that you pay versus you going out on your own with Medicare. Nothing requires you to stay on the group plan. They must let you leave the group plan if that is your desire. And it's always a good time. It's always a good idea to compare. And that's what will help you with the costs and the coverage. Sometimes you find that the costs are exorbitant, and that might be a reason to move. And sometimes people say, oh, the coverage on my group plan, it wasn't good at all. And when I look at what I can get for Medicare, I'm much better off moving to Medicare now. So just keep that in mind. So now we're going to spend some time on the costs and coverage. And again, this is where if you print off the documents that we sent to you, you will see based on 2022 what the cost structure looks like. The cost structure is valid for the whole year. And even if you come on for a portion of the year, they don't make any concession for prorating any of the numbers. So it is what it is. If you were admitted to the hospital, it would be under Part A. There is no monthly premium because of the 40 quarters that I spoke of, but there is a big whopping deductible. And the deductible today is $1,556. So it's almost $1,600. It's based on a benefit period of 60 days. So if you were admitted to the hospital and you spent 2 days in the hospital as an admitted patient, it would cost you almost $1,600. If you were there 59 days consecutive, it would cost you almost $1,600. If you went to the hospital, went home, and 3 months later had to be readmitted, totally different reason, same reason, doesn't really matter, it's considered a new benefit period. You would have another $1,600. So again, this starts to begin to paint the picture for why people want to fill in the gaps of Medicare Part A and Part B, which is referred to as original Medicare. So Part A, $1,600 in the event you're admitted to the hospital. Now, if you're still there after day 60, kind of rare, but it could happen. Now you have a copay of $389. If you're still there after day 90, you have a lifetime limit of 60 more days. So you could have hypothetically 150 days, but now you're paying $778 a day. Very, very expensive. So when a person thinks about what they're going to do with Medicare, that is of consideration in terms of what is my health history like? What's the possibility of me finding myself in the hospital? Because you can see that it would be very expensive. Now, as an example, during COVID, I had a client. Now, she knew she was going to need to have her lungs replaced. She literally went in, given the nature of her illness, very, very severe, very, very ill, on oxygen. She knew that by going with one of the supplemental options, that when she could go in for the transplant, it would be covered in its entirety, and it was. At the 100th day, I got a call from her husband, and he said, how is this going to work? Am I going to be on the hook for any of that? And they were not, okay? So that's kind of an unusual set of circumstances with somebody who knew they had some real major issues with their health, but you can see that it's very expensive. So you have to be an admitted patient. Now, if you can't go home, you might find yourself being recommended to go into a skilled nursing facility. The first 20 days are paid for by Medicare. This is where you might need some physical therapy, occupational therapy, Maybe you need some help with your medications. The first 20 days cost you nothing, but days 21 through 100, should you still be there, now have a copay of $194.50, so almost $200 a day. After the 100th day of being in a skilled nursing type of facility, it is all private pay. So you are on the hook after the 100 days. We also have hospice that is covered under Part A. And when we talk about Part A, you're an admitted patient. It's going to cover under that $1,600 figure there, if you will. It's going to be your room and board, your food. It's going to be your medications, your MRIs, your CAT scans, your doctors, your specialists, your hospitalists, you name it. It's all going to be billed under Part A. But once you leave the hospital and now you've gone home and perhaps the doctor said, I need some follow-up visits here, or you need some physical therapy, or I want you to go get some blood work, that is going to be billed under Part B as in baby. So here's where we pick up the premium. So when people were working, they were paying a payroll tax into Part A only. They were never paying for Part B. Part B changes every year. It generally goes up. This past year, it had a pretty significant increase. It went from $148.50 to $170.10. The reason for that was anytime the government passes on a cost of living increase for your retirement Social Security benefit, which was substantial at 5.9%, the government says we can increase the Part B premium, and they sure did. They took it from $148.50 to $170.10. So that was a pretty big jump for people. Know that that premium, whatever it might be for the current year that we're talking about, it applies to everybody. So it's not like you get in and you get to be grandfathered or hold it for a period of time. It's whatever the prevailing rate is for the year for the Part B is what you're subject to. Now, the way that they determine that, though, is they have a look back of 2 years. So if you're coming aboard, turning 65 this year, 2022, they're going to look at your income tax, joint or single in terms of filing, of 2020. So if your income tax and you are married is less than $182,000, that's the base premium of $170.10. If you are single and you file, and again, your income tax, they have access to the IRS tax records. They're looking at them. You are also going to be paying $170.10, and your income was $91,000 or less. When you look at the worksheets, if you do print them out and you say, you know what, my income is more than that, you're going to find out you're the lucky recipient of having to pay more. So probably over the last, I think it was about 10 or 12 years ago, the government said, for those of you that have higher earning incomes, we are going to charge you more. Not only are we going to charge you more for your Part B, as in baby, all those medical services, we're also going to charge you more for your Part D, which is your prescription drug plan. So there are 1, 2, 3, 4, there's 5 tiers. The worst possible outcome here for somebody, if they were married, for example, and their income was in excess of $750,000 in 2020, okay, and I'd like to meet this person, is they are going to pay $578.30 per month per person for their Part B. And then they also get to add another $77.90 for their Part D. So some people call it a penalty. It actually is referred to as a higher income assessment or an adjustment. They will adjust it every year as they look at your income tax. And the only other comment is sometimes people will say to me, now, wait a minute, Nance, I retired in 2020. My income in 2021, because I just did my income taxes, isn't even close to what I was making in 2020. The government has a form where you can request an exception. So I'd be more than happy to help you with that, but you do have to have proof of your 2021 income as being something less than otherwise what they're quoting you, and they would be happy to revisit it. and then they will give you a determination of whether or not they will go ahead and revise it. Most of the people that I've worked with, they have been successful. So you just have to be able to have proof that your income has declined because of a work reduction, work stoppage. There are a variety of different codes that are on this particular form. So that's Part A and Part B. Now we also have Part C and Part D. Part C is the Advantage plan. We're going to talk about that. And then Part D is the government prescription drug program. Keep in mind that anything that has a letter on it, like an A, B, C, D, and is called a part, is overseen by the Centers for Medicare and Medicaid. So that determination, we've already kind of talked about this here. Otherwise, on an annual basis, you actually do receive a letter. It generally comes in November of the prior year. They've looked at your income tax and they'll tell you this is what it's going to be for the following year. Here are the four parts of Medicare. Part A, we've spoke of. Part B, medical insurance. The Part B medical insurance, I failed to mention that typically speaking, as long as it's medically necessary and it's a Medicare eligible expense, and they do a good job of providing the coverage that you are looking for with a variety of, you need your cataract surgery, you need open heart surgery, so on and so forth. It's very expansive. Medicare will pay 80% of the claim and you're going to pay 20% of the claim. They also have a one-time deductible associated with Part B. This year it is $233. So dependent upon what you do with your supplemental or your add-on insurance will determine whether the $233 is actually required. But again, Part A, you had no premium, but you had a lot of out-of-pocket. Part B, they typically pay 80 versus 20. The 20% is yours. And there is the possibility of a deductible. These are all the medical services. You're no longer in the hospital. So chiropractor, doctor, specialist, outpatient surgery, preventative services are under Part B, ambulance ride, urgent care, so on and so forth. But you're not an admitted patient in a hospital. Part C is the Medicare Advantage plan. They've been around, I think, for almost 20 years now. And they're becoming very popular, even more so. Part D are the prescription drug plans. They were introduced in the year 2006, so more to come about them. Okay, so if you were to come in and see me, I would very much show you a diagram that speaks to, are we on the left side or are we on the right side? Because now we're going to talk a little bit more about your supplemental. Know that you cannot have both options for supplemental. So you cannot have an Advantage plan and a Medigap plan. It's one or the other. But there are some important things to keep in mind when you make that first decision. So that first decision can be when you first turn 65, or it can be when you're first eligible, and that's when you're no longer working. You have gone through the special election process and you have said to Medicare, now I need my Part B or I need my A and B. So I'm going to kind of go on the left-hand side of the diagram here and let you know that Part A and Part B is one card. It's red, white, and blue. The next item is here called a Part D. That is a second card in your wallet. That is your prescription drug plan. There are almost 40 probably 30 different plans to pick from. One of our services is to help you analyze the best plan for you because the premiums are all over the board. It depends on what medications you take. It also depends on what pharmacy you use. So what might be good for the husband might not be good for the wife because chances are they don't take the same medications. But it is a standalone prescription plan that you can renew once a year. We also will always let all of our clients know in September, open enrollment is coming. Get us on your calendars, send us your drug list, and we'll start looking at the possibilities for the upcoming year, letting you know, should you stay or should you go? The other item on the left-hand side is your supplemental coverage. Your supplemental coverage goes by a lot of different names. Some people call it a Medigap. Others might call it a Medicare Supplement. Others might call it a supplement. What this is this is your medical insurance. It will cost you more than being on the right-hand side, which we'll talk about, but it's going to provide more coverage in terms of less out-of-pocket expense. So you're basically paying up front with a premium for the possibilities of having virtually no out-of-pocket expense with co-pays, co-insurance, so on and so forth. So that's why I always show you and talk about the cost, because it dovetails back into those costs. When we talked about the hospital, a person that has a Medigap supplement, they go to the hospital, Part A with that $1,600 will be completely picked up by the Medigap. They owe zero. Whereas the person on the right-hand side that goes to the hospital, they will most likely have a copay in the area of about $300 a day. So very different. You're going to find that some people are very comfortable with the right-hand side based on their health history. And other people on the left-hand side are very comfortable because of other variables. So more about the left-hand side. The left-hand side is important to evaluate when you first are eligible, because that Medigap, that's what I'm going to call it for right now, is what we call guarantee issue. So they cannot, these are private insurance companies, they cannot ask you about your health history. No pre-existing conditions apply. So we have sometimes folks that come in and they're on oxygen or they're in dialysis, and we strongly recommend, if they can afford the premium, to really look at the Medigap, because they're going to have a lot less co-pays, out of pocket, that type of expense to deal with. The other thing is they can pick, somebody who has a Medigap, a plan that allows them to go to any doctor, any lab, any facility that takes Medicare. So there is no network. So many of you that have been on a group plan, you had to look at, did I want an HMO, a PPO, LMNOP, so on and so forth. That doesn't exist on the left-hand side. All you need to do is find out whether they take Medicare. And if they do, you're good to go. Keep in mind that Medicare is only about the 50 United States. There is add-on insurance like the Medigap that will allow you some international coverage, or coverage into Canada and Mexico and so on. We'll talk a little bit more about that. But Medicare in general, only the 50 United States, which makes sense. The other thing about the left-hand side with the Medigap is that should you have a vacation home or children that live anywhere else in the United States, maybe you stay for a period of time, you won't have a copay. And it will be very well accepted by whoever you decide to go see, as long as they take Medicare. So the insurance companies are all approved and registered, if you will, by the Centers of Medicare and Medicaid to sell specific plans that I'll be showing you in a minute that have a letter on them. These particular plans are honored and must be honored by anybody that takes Medicare. So we have people like Mutual of Omaha, United Healthcare, AARP, they're the biggest. We have Transamerica, Priority Health, Blue Cross Blue Shield, Humana, so on and so forth. The list goes on. There's probably about 35 companies. Keep in mind that some of the names like Priority Health and Blue Cross and Humana, they have plans on both sides. So it's important that you understand what the differences are, because it's not uncommon that a neighbor or a friend will say, oh, well, I have so-and-so and I don't pay anything at all. Well, that might be, because that's going to be on the right-hand side. So let's move over to the Advantage plan. The Advantage plan combines Part A and B, and it becomes C. When it becomes Part C, you still have to pay your Part B premium of $170.10 if you're at that first tier. But the beauty of the Advantage plan is they are going to offer you other services above and beyond the medical and the Part D, or the drug component of things. It's one-stop shopping. So you get one card instead of three. You are going to be working with a network of either an HMO point of service, or a PPO. The PPO is a little bit more versatile and flexible. The PPO stands for Preferred Provider Organization. You technically don't have to name your doctor, although much of your care will be coordinated because that's the whole purpose of an Advantage plan. The government said, let's get ahead of the curve. Let's do preventative. Let's have the doctors be gauged and be evaluated based on how well they can keep the client. And that's the purpose of this. It is managed care. So there's going to be a little bit more interaction in terms of the doctor. You don't need a referral to go see a specialist for any of the Advantage plans, but chances are you are going to have some kind of communication between the specialist and your primary care, because they're going to want to know, why is it that you're coming to see us? But you really don't need a referral per se. The Advantage plan has a very low premium. So I often think of these as pay as you go. So the left side is you're going to pay up front. You virtually have no out-of-pocket cost. The right-hand side says, okay, let's start out with a zero premium potentially. There's more zero premium plans than ever before. There must have been at least 10 or 12 of them out there from last year. And I anticipate that trend continuing. But everything has a copay except for the primary care doctor. So if your doctor participates, you probably pay zero. But when you get ready to go see a specialist, it's $45. If you were admitted to the hospital, it's $300 and some dollars. If you need an MRI or a CAT scan, it's probably in the neighborhood of $290. So everything has a copay. But the good news is, and this is how some people assess the risk, is every plan must have a maximum out of pocket. So the government says every year when they roll out their new plans, you got to tell us what the maximum will be. That will be published. So on average, the maximum is probably in the neighborhood of about $5,000. So what that means is the plan itself, the Priority Health, the Blue Cross, the Humanists, they keep track of all of those copays. It does not apply to your drug copays. It's strictly the medical side. They're going to send you a statement and they're going to tell you where you are in relationship to the maximum. It takes a lot to get to a $5,000 maximum out of pocket. When I see it, which it is very rare, generally the person is being treated for cancer. And now they have to pay for chemotherapy. And chemotherapy actually goes through the Part B, as in baby, of Medicare. And the person pays 20% of the cost of that. So it doesn't take long for somebody to get to a $5,000 price tag if they're receiving chemotherapy. Now they might have radiation on top of that. Everything has a copay. Maybe they needed a surgery. Maybe they also needed physical therapy to help them get back on track. Everything has a copay. Again, it takes a lot to get to the $5,000. I gave you a good example that I shared with you there, okay? So when you come in and you talk about where do you want to go, we'll help you evaluate both sides. Keep in mind that some people really need to consider the guarantee issue side, which is the Medigap because of their health. Other people might say, I want the Advantage plan. I'll tell you, there's no medical underwriting. As long as you are eligible for Medicare and you come aboard when you are supposed to come aboard with those enrollment periods, you're golden. If you want to change your plan from Priority Health 1 year to Blue Cross to Humana, you can do it every year. You can do it as long as your doctor participates or you're okay with whatever the plan design is. What's not always easy is a person will say, I'm going to start with the Advantage plan. Now, can I get to the other side? And the answer is maybe. The maybe is because you only get one freebie on the left side with no medical questions. So if you're on the right side and now your health is starting to change, it doesn't mean that you can't. But what we would take you through is a process of talking about your history of medical needs. We would look at an application from one of our carriers and we would ask you whether or not this was something that you wanted to proceed with, okay? So the interview itself is done with an underwriter if we proceed. And they don't come into your home. They don't request your medical records. It's based on you answering the questions honestly, accurately, in the interview that they do with you over the phone. So it's not that it's impossible, But the other thing is you have to remain in the Advantage plan for the whole year. So I do have people that will come in October, November, or early December, and they'll say, I think I want to move to the left-hand side. Generally, I say come in September or October, because we need to give the underwriters some time to evaluate. Because if you're not accepted, then you want to stay in your Medicare Advantage plan. That is your only option at that time. So that is the Medicare Advantage plan, sometimes referred to as Part C, annually renewable. Your prescription drug plan is built in. It is what it is. You really don't have much choice. I'll tell you that the formularies themselves are very substantial in terms of size. So chances are the medication that you have will be there. Okay, I've touched upon a little bit of this. I know we're kind of getting to the end here, so I won't go too fast, but just to let you know, here's that Medigap. It does have plan letters. The most popular plan letter this year is Plan G as in go. The only out-of-pocket expense is the Part B deductible of $233. It is based on your age. So if you're 70, you're going to pay more than somebody who's 65. It's also based on being male or female. Men pay slightly more than women, and it is based on where you live. Now, if you go with a Medigap and you do decide you want to go live elsewhere, your Medigap policy is portable. It can go with you. You just might pay a little extra based on where you're living. No health screening, talked about the doctors, and there is some limited international coverage. So if you have a question about what that is, be happy to answer it. Here's the Advantage plan. Let's see if I've missed anything there. Don't think so. Next one, Advantage plan. And again, you have copies of a lot of this. So urgent care and emergency coverage. Just so you know, if you have an Advantage plan, you will receive care anywhere in the world, and it will be at the same rate as whatever your Advantage plan was here in Western Michigan. So most of the plans have a hospital admittance, or I should say, you go to the ER, you haven't been admitted, they send you home. It's about $90 in most cases. If you go to the urgent care, it's generally anywhere between $30 to $50. That assumes that you were not admitted. And again, the point here is you can go anywhere in the world, have a $90, let's walk into the emergency room, or have a $50 and walk into the urgent care facility. A lot of the plans will also tell you that that same care in terms of copays and deductibles is going to be the same whether you're in Western Michigan or whether you're outside of Western Michigan. And again, those are things that we can talk about. But most of the Advantage plans today definitely are going to leverage the fact that they have international coverage. And certainly for those that are snowbirds, the coverage is there. Here was the Part D prescription drug plan. Just know that it's embedded in the Medicare Advantage plan. You don't have to buy a separate plan. The formularies have all different categories of coverage. The government says you got to be able to treat high blood pressure and gout and vertigo, and you name it, it's out there. There is such a thing as a preferred pharmacy or a standard pharmacy. You always want to find out which one is on your plan, okay? Because they will differentiate between. Most of the time, the mom and pop pharmacies are going to be standard pharmacies like K's pharmacies, hometown pharmacies. They tend not to be preferred. When you have a standard pharmacy condition, you're going to pay slightly more for the actual copay. They do have tiers, as many of you know. It's not unlike a group plan, and mail order is also available. This is called the coverage scenario, if you will. Stage one is what's called the deductible. Some of the plans have you paying a portion or all of the $480, depending upon your drug. Stage two is where you're paying copays. It could be a 0, or it could be a 42 or a 78. It all depends on where that drug falls in terms of tiers. Again, that's what we will do for you. We use Medicare.gov as our tool. Stage 3 is called the coverage gap or the donut hole. This is for a person who spent over $4,000 in the retail cost of their medications. Now they're going to be paying 40% of the retail cost. So if the retail cost was $400, Now they're in the coverage gap. In the 10th month of the year, they're going to be paying $100 for that drug that otherwise in the past only cost them $42. The last stage is the catastrophic level. Very rare somebody finds themselves here, but it is a helpful stage other than you've spent a lot of money to get there. The donut hole is closing. It will never close in its entirety. 2020, they brought it all the way down to the recipient paying 25%. In 2006, when they rolled it out, the member paid 100%. So if they had the $400 retail drug, they paid $400 back in 2006 versus today, they would be paying $100 for finding themselves in the donut hole. There are some cost reduction ideas for drugs. So again, if anybody wants some help, we can go into more detail, but there are some foundations that treat specific kinds of maladies, if you will, and they will help. Meyer in the past has had some freebies that you can avail yourself to. And we've even worked with some pharmacies in Canada where it makes sense to perhaps do a little bit of a comparison between what does it cost here or what if I decided to go to Global Pharmacy or Mark's Marine. What isn't covered by traditional Medicare is listed along the left-hand side there. The biggest one is going to be long-term care after the 100 days. Yes, there is some care outside of the United States if you have supplemental, otherwise there's not. The idea of getting dental, vision, and hearing, you're going to do a good job with that with the Advantage plan, but it's all extra if you have the Medigap and the Part D. Cosmetic surgery is not covered by Medicare, so if anybody wants a facelift, not part of what they're going to do for us. Acupuncture is becoming a little more recognized and accepted. So some of the Advantage plans do allow for some visits to an acupuncturist. Keep in mind, everything is about the network on the Advantage plan. Everything. You want to go to the eye doctor, you got to make sure they're in the network. You want to go to the dentist, you got to make sure they're on the network. Very, very important that you don't find yourself outside the network and now you're paying more and you don't know why. Any amount over the Medicare approved amount is also your responsibility. You always want to make sure not only does the doctor take Medicare, but that they also accept the Medicare assignment. Because if they don't, they might try to pass on some of the difference to you. Here's some important need to know. Anybody that hasn't gotten the shingles shot that may be on a group plan, I recommend that you get it. Otherwise, you're basically going to pay for it. Part D versus Part B, that's got to do with the chemotherapy. It's an infusion. That goes through Part B. It doesn't go through Part D. If you have a Medigap plan, you can revisit it at any time of the year, but you got to stay pretty healthy because now you got to answer those medical questions and talk to an underwriter. Remember, if you are in any part of Medicare, A or B, you may not be in an HSA. COVID-19, we know all about that. All these tests are covered. Telehealth is becoming a big deal, partly because of COVID. It was here before that, but that is definitely here to stay. And then anybody that might be on insulin, there are some insulins that now have a fixed $35 copay. And they do not go through to the donut hole. So that's a huge advantage to those people because often they found themselves there. So coming in for a landing here, these are some tools and resources for you. I referred to Medicare.gov. That's where we do the analysis for Part D and also look at the carriers that are available. SSA.gov is where you enroll in Part A and Part B, or you look at your Social Security benefits. Nobody can get into mymedicare.gov and tell you actually are in Medicare, but it will show you all of your claims. Again, this is their effort to have you move electronic, to have all your documents be out there. Once a year, you do receive the Medicare and You book. I use it as my handbook. It's a wonderful guide, especially when you get into the index and you just want a place to start. If you have a Medigap policy or considering it, they also have a guidebook that you can review. Carrier websites, they also have a wealth of information if you want to continue your education about Part A, B, and so on. And talk to friends and relatives. What do they have? Just keep in mind that you want to say, now, do you know what kind of supplemental plan you have? Because a lot of people do not know. So if you ask them what their premium is and they tell you it's in the $100 range or more, you know that they're in a Medigap. Or if they tell you that they have a separate drug card, you know that they are on the left-hand side of the diagram. So here's our offer to you. We do not charge for any type of consultation, whether it's over the phone or it's Zoom, or you come into the office, and it will be very personalized. We'll ask you some information about you so that we can prepare in advance so that we can make good use of our time. Again, never charge. We're compensated by the insurance company, but this is kind of our process here. We're going to do the analysis. We're going to review all of it with you. If you do find yourself a candidate for the coverage gap or the donut hole, perhaps there's some other things that you can do that would minimize that big hit in the coverage gap. We're always going to recommend the most cost-effective plan, even if I don't represent it. There's a few prescription drug plans I do not have. And if it turns out that's the right plan, I will still help you get enrolled. I just don't get paid for it, but that's the right thing to do. Again, for those of you that are coming aboard or thinking about it, your IEP is for those that are turning 65. If you're 3 to 4 months out, give us a call. For those of you that are thinking about quitting and no longer having access to your group plan, or you just simply want to do a comparison of should I stay on my group plan or should I go to Medicare, give us a call. We'll be happy to evaluate that. But anybody that actually is going to pull the trigger, they have to have those 2 forms. We'll provide the 2 forms to you, and then you can go ahead and submit them to Social Security and do what you need to do, and then we'll help you with your supplemental. So here's our website. It's full of information, nancycourser.com. We have a phone number. Option number 2 is our side of the business. Option number 1 is the retirement planning or the wealth side of the business. We have email addresses listed. The first one is mine. And I do a lot of email, get back to people in the evening. So if you don't hear from me, you will. But a lot of times I'm in front of the TV and I'm responding to my emails at that point. But I will get back to you generally within 24 to 48 hours. And then Lauren Kent, she is the sales support side. So if you do set up an appointment, she's the one that's going to call you to work through what's going to work best for your calendar and so on. And I think, Chris, we got questions. If we do, otherwise I'm at the end.
Yes,
okay.
We do. I'm also going to launch a poll for everyone on the, first of all, thank you so much, Nancy, for sharing your expertise. There's a lot of information. So much appreciated. I'm going to launch a poll and we can get into the questions as well. Can you see the questions, Nancy?
No.
Okay, I'll let you know what they are then.
Okay.
Okay. So the first question, I am a retired federal employee and I can carry my full health coverage, health insurance for the rest of my life. Can I carry my full coverage insurance and be covered under Medicare Part A without being covered under Part B?
And it depends. So I am not the one that can answer that. I've seen it both ways. So unfortunately, it is out of my realm, but what you need to do is you need to contact whoever you work with at the HR side of things, because I've seen it both ways. Most retiree plans, I'm not talking about the federal, you absolutely have to sign up for A and B. But I wouldn't want to be the one not knowing what those documents look like from the U.S. Fish and Wildlife, and they're all different, as to whether or not you have to sign up for both parts, okay? So I know people will try I know that the concept there is, why should I sign up for B and pay for something I don't need to? But I think you got to check with the HR department and make sure that you get a definitive answer.
Because it goes on to say, is it true I can continue to carry my full coverage for a few years and then change to Medicare without paying the delayed Medicare penalty?
Well, it depends on whether or not he had to sign up for Part B. And if you're an active employee, okay, you can sign up.
Retired.
You did say retired. Okay, so I'm going to say if you are retired you're going to have set the stage in the very beginning by getting an answer from the HR department. So if the HR department says you can just sign up for A and you don't have to sign up for B, then the answer is there is no penalty. And I
Okay,
probably would actually have to call, and I have a contact at Social Security. I would probably want to contact her and say, look, he had validation. He didn't have to sign up for Part B. He did not. Now he wants to make a move or evaluate A and B and something else. How do we go about doing it? So on and so forth. So I'd have to treat that one independently, but I could get an answer. Yes.
okay. Next question. I notice you have to resign from your Medicare benefits in order to enroll in the Advantage programs. Wondering if they are better than Plan F medical through Medicare. My Plan F supplement is not expensive, under $200 a month, $2,400 a year, because I am 74 and have no health problems. I was wondering if switching to a Medicare Advantage program at next open enrollment, like Priority Health, which often has no premiums, would be something advisable. Don't know the possible charges you might get in going to the Advantage plan, co-pays, limits on hospitalization, etc. Do you have any information on that? That sounds like a good meeting for you, Nancy.
It definitely does. And we could even meet before open enrollment if she wanted to get a flavor for what the Advantage plan out of pocket looks like. So generally, when I sit down with a person, you have to still be an A and B. So that doesn't go away. Everybody's got to have A and B. Couple things. One, if you start with a Medigap, which is what she has, and you want to try the Medicare Advantage plan, you can, okay, after you've done some good analysis. If you get into it, they give you a 12-month trial right. So if in 6 months you don't like it, didn't work the way you thought it was, you can return to the Medigap without medical underwriting, only one time. So they give you a 12-month trial. If you stay in it for 13, 14, whatever, and then all bets are off and you'd have to go through the medical underwriting. The way I generally look at the evaluation is, imagine taking that $200 times 12, she's got $2,400 that she could use for copays. So we try to estimate as best we can. Nobody's got a crystal ball, and say, look at what would be the what ifs. If the what if is I was in the hospital, I just spent $650. If the what if is I go to the specialist 4 times a year, now I got $200. And if we can keep it below the $2,400, it might be worth a try. That's exactly what my dad did. He had the Medigap. It was starting to increase. He wanted the dental, vision, and hearing that he didn't have. Every time I talk to him, he's relatively healthy. He says, I love it. He said, I have no reason to go back. It's working just fine. If he has a bad year and he hits the $5,000 maximum out of pocket, he might only have 1 year of that. So that is your risk. But what about the next year? The next year, you might have only spent $300-400 on your care. So we try to evaluate that as best we can.